Thank you, Governor. Good afternoon, everyone. As usual, thank you for being with us. We are entering phase 2, and it is an important time. We're able to do this because our COVID-19 numbers have been stable, and it's something that we will need to continue to follow. As the Governor has said, we are not out of the woods yet, but we are moving in the right direction. And this is largely because of your patience, your cooperation, your decisions to prioritize health and well-being for yourself and your fellow Rhode Islanders. All of that has contributed to us being where we are. So thank you. I also want to recognize and thank the dozens and hundreds of people who are working behind the scenes as part of Rhode Island's COVID-19 response team. An incalculable amount of time went into preparing Rhode Island to confidently transition into phase 2. The people who put in those hours also deserve a huge thank you. To spend a few minutes on data, we have 67 new cases to report. On Saturday, we had 171 new cases, and we reported 106 cases on Sunday. There are 195 people with COVID-19 currently hospitalized in Rhode Island. This compares to the 219 and 206 numbers that we reported on Saturday and Sunday, respectively. We have 46 people currently in the intensive care unit, and 29 of those 46 people currently on a ventilator. Sadly, we have 2 additional COVID-19 associated fatalities to report today. One of these people was in their 70s, and one of them was in their 90s. Our prayers go out to the families of these 2 treasured Rhode Islanders. They also go out to the families of the 18 people whose passings we reported on Saturday, and the families of the 7 people whose passings we reported on Sunday. While every single loss is incredibly tragic, we hope to keep up this brief trend of reporting fatality numbers that are on the low side. Now to reflect on some of what the Governor shared regarding equity. As we have said in the past, health equity is a major focus for the Governor, for the Rhode Island Department of Health, and for all of our colleagues across state government. It is a major focus across the entire administration. While we can be encouraged that the percent positivity overall as a state has trended in the direction that we want to, as the Governor shared, we also have our eyes laser focused on those communities that still have the percent positivities that we want to address. The Governor mentioned Central Falls, 26% positive. Providence, 24% positive. North Providence, 17% positive. Pawtucket, 16% positive. And Woonsocket, 15% positive out of all of those tested in the respective areas. These are numbers that we all agree are unacceptable, and while they are occurring in those communities, it's something that we all as Rhode Islanders have a responsibility to address. The Governor and our entire team is laser focused, as I've mentioned, on being able to respond in an aggressive way, in a comprehensive way, in a thoughtful way to the communities that are experiencing these percent positivities. We have a team that's worked on this for weeks, through the weekend. I was up reviewing through the night. We will be talking to the governor about this later this afternoon. We are committed to making sure that with whatever interventions we have in place, we want to take that impact to the next level, particularly in the communities that are disproportionately impacted. We know that that is going to have the benefit needed across all of Rhode Island. Our vision is that everyone has an equal opportunity to be healthy, no matter what their zip code is, no matter what their race is, no matter what their ethnicity is, sexual orientation, gender identity, level of education, level of income, or insurance status. We know also that data plays a huge role in our work to make that vision a reality. And teams of people work very hard to help that data inform the actual steps that we need to do. That's why we have worked with community partners to have healthcare providers and testing sites start gathering data across the board. We echo the value principle that we've learned with health equity zones. We need to make sure that the community's voice is at the forefront, and that's what we are responding to help address crises such as COVID-19 and the crises that communities face on an everyday basis. With June also being an acknowledgement of our LGBTQ community that we always want to uplift and prioritize, we are going to start gathering data on sexual orientation and gender identity. We know that that's going to be critical for us to continue to respond to every community that we uplift. This update of being able to gather data that we can now help inform our response with our LGBT community should be implemented very shortly, and we're going to start working with hospitals and all other healthcare providers to start collecting these data for COVID-19 patients as well as we go forward. We're grateful to all who worked to make this happen, knowing how critical data is to help inform the work that we know we need to do.